All right, we're going to move on to our next speaker. And to introduce our next speaker, I would like to introduce Eden Rapp. Eden is one of the board members of Disability Voices United. She's an incredible self-advocate who has been to Washington, to Sacramento. She lobbies for the National Down Syndrome Congress, as well as for DVU. She's led workshops. She's so creative in her approach to helping other self-advocates. I adore her and her family. And I would like to now introduce Eden Rapp.
Thank you, Miss Judy, for that introduction. And I also want to give a big shout out to Miss Judy Mike for allowing me to introduce someone with a very big honor. For Ms. Alison Barkoff was appointed by President Biden and is currently serving as acting administrator of the Administration on Community Living in the United States Department of Health and Human Services. She advises the Health and Human Services Secretary on issues affecting individuals with disabilities and older adults. Ms. Allison has been a long-time advocate for people with disabilities. She served as a director of advocacy for the Center of Public Representation, where she led policy and legal advocacy with federal agencies and Congress to advance community living and inclusion for people with disabilities in health care services, employment, housing, and education. She has testified before Congress and the U.S. Commission of Civil Rights. Ms. Allison also served as Director of Advocacy at the Basel Center for Mental Health Law and as Special Counsel for the Olmstead Enforcement in the Civil Rights Division of Department of Justice, leading efforts to enforce the rights of people with disabilities to live, work, and fully participate in their communities. But most important, Ms. Allison had a sibling with Down syndrome. Adult brother with Down syndrome. This means she has been advocating for people with disabilities her whole life. I have a brother. I have a sibling who means a lot to me. Ms. Allison, I'm sure you are the best sister in the world. Thank you, Ms. Alison Barkoff, for standing up for your brother and me and so many others. And thank you for speaking to our community today. And now I'm proud to introduce Ms. Alison Barkoff. Thank you.
Thank you. Thank you, Eden. I think that I have had a lot of opportunities to speak since I started on January 20th, but I can say 100% that was the best introduction I've had yet. So thank you so much, Eden. It's a real privilege to be here today and to be speaking with Disabilities Voices United. It's actually not the first time I've had this opportunity. As Eden mentioned, I've been a longtime disability advocate, and I was really privileged to speak with your organization in November when we were talking about why it was so important, how to make our voices heard, and why it was important to vote. So I'm really excited to be back today, wearing a little bit of a different hat, and to talk to you about the Biden-Harris administration priorities around disability. I want to first start off just sharing a little bit about my background and my personal story to add a little bit to what Eden said. A totally beautiful introduction. I think my other two sisters might have a little fist fight with me if I claim to be the best sister for Evan, but I am one of three best sisters for Evan. And I feel really privileged to be here on behalf of the administration. As Eden mentioned, I joined the administration for community living on Inauguration Day, and I'm currently serving as the acting administrator. And I'm so lucky to be working at an agency whose mission and the work that we do is very much the work that you do. It's about supporting opportunities for community living for all people. This has been my own life mission, and I feel just so privileged to be able to push that forward. I've been involved in disability advocacy my entire life, and over the 40 years that my brother has been part of the disability community, I've seen the many ways that families like mine 40 years ago were told the only place for people like Evan were segregated in an institution. There was no such thing as home and community-based services. And over the last 40 years, the world has changed so much for people with disabilities. And I've been part of seeing how our service system has changed, really centering how do we make sure that people with disabilities are able to get the supports that they need to live the life that they want. I also really approach this work not only knowing that what people with disabilities and their families want is to live and participate in the community, and that those services lead to better outcomes, but I am also a civil rights lawyer. And so it's not just that this is the right thing to do, it is that people with disabilities actually have a civil and human right to be part of their own communities. Much of my work has been around enforcing that right and helping people make that right real. And I bring that work with me to this new position. I just want to talk a little bit about Evan, because I think it really, especially being at a conference where self-direction and self-determination are so centered. Evan was told when he was born, there was no place for you but an institution. The best thing for all of us would be to separate him and segregate him in an institution. Fast forward 40 years, and Evan, just like Eden, is an incredible self-advocate. He is a member of the Council on Developmental Disabilities in his state. He, with support, is able to live independently in an apartment with a roommate of his choice. He has a great job where he's a valued coworker and is paid a living wage. And he has, frankly, a more active social life than I do. And the reason he's been able to have that life is because he has been his own best self-advocate. Just over the last several years, Evan has moved the way that his services are delivered, and he now self-directs his own services. And I've really been able to see firsthand how that has created some really great opportunities for Evan to design his own services and supports in a way that really helps him achieve the things that he wants in life. So I really come to this conference and this speech knowing the real value of consumer direction for many people who make that choice. So let me start by just telling you a little bit about what the Administration for Community Living is, or ACL. We are a federal agency that is inside the U.S. Department of Health and Human Services. And we have a couple important things that we do inside of ACL. The first thing is that we fund disability and aging organizations that are part of our networks. And they are partners that are in your own state. Probably many of the 700 participants might even be tied to some of these organizations. So we fund the protection and advocacy networks. Those are the legal advocacy organizations that are in every state that assist people with disabilities. And in California, it's called Disability Rights California. We also fund the State Developmental Disabilities Council. And in California, it's known as the State Council on Developmental Disabilities. We also fund the University Centers for Excellence in Developmental Disabilities, or UCEDs. And you have a number of UCEDs across your state that do a lot of incredible work around research and self-advocacy, working with health professionals on learning about disabilities. And I think you have several across your state, one at UCLA, one at the Children's Hospital in Los Angeles, and one at UC Davis. We also fund the network of Centers for Independent Living, and you probably have many of those across the state in all of your communities. They're sometimes known as CILs. We have programs across the country that assist with assistive technology, traumatic brain injury, limb loss. We fund aging and disability resource centers. We have aging networks across the country, and we have information and referral centers that work with people on Medicare. So one really important thing that we do is work with all of you at the state level through these networks. The other role that we play at ACL is we are designated, we are the agency that provides advice to the Secretary of HHS and across the federal government on disability and aging policy. So all of the things, and I know there have been so many webinars that Judy has done for DVU on a whole bunch of different federal policies and what it means for you. At ACL, we get to have a role in saying, what is it that people with disabilities want? How can we make sure that any of the policies that the federal government is putting out really helps move forward the things that people with disabilities and their families want? So just to give a couple examples of the kind of partnerships that we have across the federal government in this role as advisor is we work on issues around funding for home and community-based services. And in listening to the end of your last speaker, talking about the kinds of home and community-based services that are available in California. That's a state and federal partnership through something called Medicaid. And we are able to work together with the agency that oversees Medicaid to make sure that the things that are important to you are able to be done with Medicaid policies. Person-centered planning is a very important thing that we do in our work. It's something that we run a national resource center on person-centered planning. We work with entities across the country, including states, on how to really center people with disabilities and making sure that services and service planning is about how do we help people reach their own goals, not about a medical model, not about what the system wants for someone. And so that's a really important piece that we play. I talked about the importance of civil rights for people with disabilities. And hopefully most people have heard of the Americans with Disabilities Act. We've just passed the 30th anniversary of that law that provides so many rights to people with disabilities. So the right not to be discriminated against in your workplace, the civil right to be included in your community, what we call sometimes the integration mandate, or we talk about the Olmstead decision from the Supreme Court. There's so many pieces around civil rights. And again, that's another place where ACL partners across the federal government. We know that for people with disabilities, when we're thinking about inclusion and community living, there's so many important pieces. It's not just about access to services. It's about housing. It's about transportation. It's about employment. It's about inclusive education. And again, part of our role is working across the federal government with other agencies on policies to make sure that those issues are front and center and that we can lift up the important priorities of the disability community. So that's a little bit about who ACL is. I want to turn now to talk about some of the Biden-Harris priorities and how they relate to people with disabilities. Like most of you, maybe all of you, before I joined ACL on January 20th, I had spent the whole year before, throughout COVID, really, I would say almost screaming from the rooftops about the many, many ways that people with disabilities were so impacted by COVID. I mean, it's been really the most heartbreaking, the most just dire situation for people with disabilities, for people who are in institutional and congregate settings, the disproportionate number of people who have gotten infected with COVID, who have died from COVID in congregate settings, people who have been cut off from friends and family because of visitation policies to try to, quote unquote, protect people in settings. When we think about the loss of services and what that has meant to people who were in their own homes, and how providers had to really immediately change their models to be able to continue to provide supports to people and still keep them safe. So, you know, alongside many of you, I was pushing to make sure that the response from Congress and from the government centered people with disabilities. And in so many ways, the first year of COVID, I would say many people in our community felt like we were invisible and we weren't really covered by those responses. When I joined the Administration for Community Living, it was clear from day one of this administration that COVID and its impact on just the many different communities that had been hit by COVID was a top priority. And for the Administration for Community Living, our top priority has been COVID, 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 and COVID. We have been working alongside partners across the federal government, including the Centers for Disease Control, or CDC, as we've been working to implement a plan that the president put out on one of his first days as president, and a set of executive orders, which is directing the federal agencies to take action. And I'm sure most people probably haven't taken the time to read all 200 pages of this strategy, but I would say for all of us who had been working so hard to highlight all the ways people with disabilities had been impacted, it was so important to see in that plan the many ways that the Biden-Harris administration has laid out from day one that people with disabilities must be centered in the response. Whether we're talking about making sure people with disabilities can access vaccines, that the caregiving workforce has to be addressed, that we have to make sure home and community-based services are available to keep people safe in their own homes. And really thinking about this through an equity lens. I want to just touch on a few things over the last couple weeks that we have been working on in the area of COVID and how it really will have an impact in California. I know that so many of you and many of our networks in California have been working so hard to make sure people with disabilities can access vaccines. We know that if we just say everybody has to go online, schedule their own appointment, get themselves to a vaccine center, stand in line, we know that we will miss so many people with disabilities, and we need to put intentional focus in reaching out to people with disabilities, particularly people with disabilities in communities of color, people with disabilities who may be living in poverty, people with disabilities who may not speak English as their first language, to make sure not only are we reaching them, but that we are providing the support that people need to get vaccines. For some people, that may be helping them find a place to get a vaccine. For other people, that may be providing transportation or providing a support person who can go with them to get a vaccination. For other people, that may mean making sure that the site they are going to is accessible. And for other people, that may mean finding a vaccine, a way to bring the vaccine to them in their own home. We have been working so hard to make sure that the White House and CDC, in their work to reach all vulnerable communities, are really focusing on people with disabilities. And 2 weeks ago, the President of the United States, President Biden, announced $100 million in funding to the Administration for Community Living for us to send to our disability and aging networks to help on the ground with vaccine access and education. That money is already out hitting the streets, and I really want to recognize the incredible work that is already being done by our networks, including those in California. And we feel really privileged to have been able to have gotten this additional funding to help increase your efforts. As I mentioned, civil rights is just a really critically important piece, even when we're thinking about vaccine access. And just this week, together with the Office for Civil Rights in HHS, we issued a document talking about what are the legal obligations that public entities like public health authorities have in terms of ensuring that all parts of the vaccine process are accessible to people with disabilities. And what we talked about in our companion document, so the Office for Civil Rights enforces the law. What we wanted to do is really provide what are some good examples of how partnerships have been happening with disability organizations at the state and local level to ensure accessibility. And so I can share the document in the chat when I am done talking, but we have this package of information that we have both on the legal requirements and strategies for making sure vaccines are accessible that we just pushed out. And we hope that you can use that in your advocacy. So that's one of our main priorities is around COVID, COVID recovery, COVID vaccine access. The second piece that's been really exciting as someone who has spent literally my entire life trying to work alongside disability advocates to make sure that people with disabilities can get the supports that they need to live the lives that they want is to move forward the president's agenda around caregiving. Hopefully people have seen that as part of economic recovery, President Biden has talked about how we must focus on the care economy and the caregiving infrastructure. And it's pretty amazing for many of us who have spent a very long time trying to educate policymakers about what home and community-based services are, to see that a centerpiece of the recovery is focused on both formal services, including expanding home and community-based services, talking about the formal workforce of direct care professionals and how we really need to focus on improving the wages and improving the career ladders for people who provide this critical care. It's not only about the fact that this workforce is so critical and so important, but it's also a matter of equity. You know, many people who provide direct care, the majority are women, and particularly women of color, and many of the issues around the low wages and how these jobs have been devalued really come out of a history of systemic racism and devaluing of work provided by women that make this really an equity issue as much as it is about focusing on helping people get what they need. It's been a really exciting time to see the things that have already happened over the last 2 or 3 months. As people may know, the Money Follows the Person program, which has been a really important federal program to help people with disabilities and older adults transition from nursing homes and other institutions to the community, was recently reauthorized by Congress. And at ACL, we are working very hard to make sure that we are supporting states and all of the networks on the ground to take full advantage of this program. In the American Rescue Plan that was just passed last month, there was the biggest increase in home and community-based services funding in decades. $12.7 billion going to increase funding for community services. And that's an incredible opportunity as all of you in California are working on what are the ways that we really need to improve the services that are available to people. How do we need to make sure that as we are starting to come out of COVID, that the services that are there can really support people to live the lives that they want. The other really exciting thing is that about 2 weeks ago, President Biden announced his jobs plan, and a centerpiece in that $2 trillion jobs plan is an investment in the care infrastructure. He proposed $400 billion to increase home and community-based services and support the direct care workforce. And this is really an incredible opportunity for all of us. You know that you've really hit kind of a mainstream issue that impacts everyone when literally every time you open a newspaper, we're now starting to hear about home and community-based services. Just last week, one of the late night shows had a 20-minute piece on long-term services and supports. I want to say I'm really coming into this job with such excitement and enthusiasm that we really have this once in a lifetime opportunity to work together, to think really big, to think about how can we make sure people with disabilities are getting the services and the supports that they need to live the lives that they want, that we are supporting caregivers, both formal and informal, including family caregivers. And of course, this includes all aspects of people's lives, from where they live to employment to other ways that people participate in the community. And of course, the workforce issues, I think there's a really important tie-in with consumer self-direction. And self-direction is one of the many critical solutions as we are thinking about the workforce. It is a way to bring in people into the direct care workforce who might not otherwise have chosen this job, but for the relationship that they have with the individual that they are providing services for. Self-direction provides opportunities for the participant, for the person receiving services, to have more control over the types of wages they're able to provide, the person who is providing services. And so it's a real win-win. And I hope it really is an important part of the conversation as we move forward. And then the last priority I just want to touch on, and then we'll turn it over to Judy to open for questions, is talking about equity. Truly, from day one, the Biden-Harris administration has centered equity in a way that I think is really just incredible. It is about equitably doing every single thing that we do. It is about every policy. And the administration has put out an executive order on advancing racial equity and serving underserved communities that has a real intersectional lens, the way that the disability community approaches equity. So we know that people with disabilities and disability itself is an identity that we need to think about in terms of equity. But we know that the experience of people with disabilities who are also people of color, who are also people who are LGBTQ, who are also people who live in rural areas, who may also be people living in poverty, who may not speak English as a first language. Those are all ways that identities come together, and people face different systemic barriers based on their experience. In the Administration for Community Living, we're really approaching equity in two kinds of ways. The first way is we think it is critical in all of the work that we are doing around disability that we think about those intersectionalities, particularly centering racial justice, and really look at the barriers that different communities and sub-communities within the disability population face, and what we can do to address those systemic barriers. But remember, I also said ACL plays a role across HHS and across the federal government. And we are committed to making sure that when the rest of the federal government is thinking about equity, when they are thinking about how are different communities impacted, that the intersection of disability is also part of that broader lens. So we're working, for example, with the Office of Minority Health, and as they are looking at how do different minority communities have different barriers and health inequities, we want to make sure that they are looking at disability and those intersections there. We are really, really looking across the country, across the disability community, and across our networks to learn and lift up the great work that you all are doing around equity, and really would be interested in hearing from all of you, particularly from disability-led organizations, from self-advocates, about ways that we can collaborate to really move forward the administration priority, and I know all of our shared goals on making sure that we have an equity lens in everything that we do in the disability community. So with that, I just want to end by saying it's an incredible privilege to be here. I never say no to self-advocates, and when there was an opportunity to speak to such an incredible audience that is really driven by centering the voice of people with disabilities themselves, I really wanted to take advantage of this opportunity, and really just want to thank you for everything that you do and for this opportunity to speak with you today. So I will stop there and turn it over to Judy.
Thank you so much, Alison. I wish you could hear all the applause out in the world. I'll applaud for everybody. It was like, I'm getting texts, I'm getting private emails. She's so amazing. Where did you find her? I'm like, she's been around. I've been stalking you. I've been reading everything you write for years as an advocate. And I'm so honored and thrilled that you joined us today. There's a couple of questions that have come up, if you don't mind taking them. One of them is the most simple question. How many people work on the developmental disability community in the ACL?
So in ACL, we have about 200 staff. And that question is a little bit hard because we have some parts of ACL that are only aging, some that are only disability, but we have a lot of parts of ACL that cross disability and aging. So I would say probably about 120 to 130 people across our organization work on disability issues. I like to think of us as small but mighty, because as I talked about, our power is not in that we are the biggest agency or have the most money, but in our partnerships. And so I like to think of ACL staff as kind of an extension of, well, HHS Office for Civil Rights is kind of ACL staff because we work on these issues with them. The Center for Medicare and Medicaid Services, those are also some of our partners. So we have, I think probably a little over 100 people who directly do disability work, but But again, it's really, our philosophy is about collaboration, about force multiplier by our partnerships. So small but mighty.
Wonderful, thank you. Another question is, can ACL, I almost said ACLU. I'm sure I'm not the first person that accidentally added the letter. Different organization completely. Can ACL be the agency that holds regional centers accountable and oversee the progress on racial and ethnic disparities? The issues surrounding disparities have been a long time issue and there needs to be oversight.
So I'm always, I have to wear my bureaucrat hat when I hear words like oversight. So, the regional centers, as I understand regional centers, and Judy can correct me if I'm wrong, part of what regional centers do are put in place the services and supports that are part of the Medicaid program that is the state and federal partnership. And there's a different part of HHS called the Centers for Medicare and Medicaid Services that has that. When you say the word accountability, they are the ones who, if the regional centers are not following Medicaid law, they are the ones who could, who work with them to correct those problems, who have that oversight role. The role that ACL is playing, and I think, I really want to emphasize we are doing and we would like to do, is working across the board. And we are working with CMS to talk with them about how in their programs that they administer, can we really be building in racial equity and really equity across the board in all the ways that I spoke about. One of the executive orders that we are implementing in HHS right now is about how do we build the data, how do we start collecting the data that exists across the board. So right now, I think if you went and looked at CMS data, they probably don't have enough information about regional centers. How are you reaching out to, people of color and different types of communities? And, how many people are you serving who are LGBTQ? How are you reaching out to communities that don't speak English as a first language? So I think we are trying to actually build in, we can't hold people accountable if we don't have a way to measure. And so that is an important piece. Again, I'm happy to share with you, Judy, there was a specific part of that executive order that directed federal agencies to work on this data collection piece. But we are very much thinking about and talking to CMS and really across the federal government about ways we can build in equity and reporting on equity across all of the programs in the federal government. So our role is to work with partners to build that in.
Wonderful. Thank you, Alison. I think I misspoke on the very first question. The questioner wanted to know how many people with intellectual and developmental disabilities actually work at the ACL. Do you hire folks with IDD there?
We do hire folks. I don't have our data. So the one thing I would encourage anyone, first of all, working for the federal government is a really, really great job. And as people may know, the federal government has, wants to be a model employer on disabilities. We actually have targets to hire not only people with disabilities, but people with targeted disabilities that include people with intellectual and developmental disabilities. ACL's staff has always been incredibly diverse, and I think we are probably the leader across, I would say, the entire federal government in terms of disability hiring. We have ways that we can actually preference the hiring of people with disabilities through what is called Schedule A. And at every opportunity, we do try to do that. I just started 70 days ago in a virtual world, and I'm still actually getting to meet all of our staff. But I think we have probably more than 20% of our staff who are people with a range of disabilities. And I am committed personally to hiring people with disabilities. I think we cannot do this job if we do not have people with lived experience. So very happy to talk to anyone about opportunities working in the federal government, including ACL, but I don't yet have our demographic data at the top of my head, but happy to get back with you on some of those issues.
Wonderful. We may only have time for one more question, but I think it's a really important question. And as you had talked about, there's a rule coming in 2023 now, 2023,
Yep.
in a couple years that will require all services. Right now, all self-determination services must be fully included in the community. This rule is called the HCBS, or Home and Community-Based Services Final Rule, which is a very complicated, I just call it the inclusion rule because I can't stand acronyms and using them all the time, but this is my opinion as opposed to standard, we're an advocacy organization. I believe that California is far from ready to go. And so what steps is the ACL going to take over the next couple of years to ensure that states like California are ready to go when the deadline hits?
Sure. So as Judy knows, I could probably do a webinar for 3 hours on the settings rule. And I think I have done 1 or 2 for you before. But just for people who don't know, the HCBS settings rule that Judy is talking about is a rule that actually I was personally involved in creating the last time I was in the government, in the Obama administration, that is really about the most basic civil rights and what does it mean to live in the community. These are really basic rights that people should have the ability to make choices in their own daily lives, that people should be able to make decisions about where they go, what they eat, who they share a room with if they would like to have a roommate, that they have access to the community. And while I think when people outside of the disability community look at the rule, they say, what, you're now 7 years in and this isn't done yet? Like, really? You're talking about what, people actually being able to decide when they go to bed and wake up. And I think for those of us who have spent our lives in the disability community, we know that that's actually not where all services are yet. The model of services started decades ago that were about just creating something that was less bad than an institution. And we have learned over decades that people with disabilities are completely capable of living their own lives with supports. And so this really is about big systems transformation. ACL has been working very closely with CMS, the Centers for Medicare and Medicaid Services, because as we talked about before, this is their rule that ties to funding for any providers who get that kind of HCBS support. We are committed to making sure, number one, that the voices of people with disabilities at the state level are driving these plans. We worked very hard to make sure that the rule includes opportunities for public comment. And so Judy knows whenever your plan in California is out for public comment, it is crucial that particularly people with disabilities who receive supports talk about the way that what their experiences are, either do or don't, really seem like they're meeting with the rule, the kinds of services they want that aren't available. And of course, the voices of providers and families are also important to informing that. We really want to be a partner. We reach out to our networks when those plans are out, and we are continuing to push CMS to make sure that this rule is implemented as it was intended. This is truly about people living lives with self-determination. And I think it is an absolute missed opportunity if we do not all work together to make this real. California may have work to do. There still is time, but we can only do that if we all work together and push hard. And we're happy to support you in any way that we can.
Wonderful. Well, I want to thank you so much, Alison. We are so honored in the first few months of your leadership at the ACL that you have. I almost said ACL. Your first few months of ACL that you have given us time this morning and kicked off our conference with an incredible keynote. We promise we're going to stay in touch with you. We have a lot to do. Our self-determination program is everything that the ACL really stands for. And so we're excited to be partnering with the federal government. We're so happy to hear the priorities of the Biden administration. It sounds a lot better than what we've been experiencing for the last 4 years. So, I mean, all the words you said, like inclusion and employment, all these things that we've been wanting to hear for a long time. So thank you so much. Please take care.